Welcome to If You Know Someone with a Vagina,
or as we like to call it, IYKSWAV.
IYKSWAV. Hi, I'm Sandi.
And I'm Beth.
We are recently retired nurse practitioners, excited to bring you a podcast filled with informative insights, compassionate discussions, inclusive perspectives, and expect a healthy dose of humor. Whether you have a vagina or you know someone who does, this is the podcast for you.
The content of this podcast is provided for general informational and entertainment purposes only and is not intended as, or should it be considered, a substitute for professional medical advice. This episode of IYKSWAV is so important, it could save your life.
Why, you ask? Because we're talking about GSM, or Genitourinary Syndrome of Menopause, which we're going to call Gotta Stay Moist. And we're about to explain why.
So GSM is super common.
Yeah, like 50 to 80% of menopausal women.
It's a condition that affects our vaginal and urinary health due to declining estrogen levels, and it's really underdiagnosed.
Yeah, we're talking not only about vaginal dryness, but pain during intercourse, urinary frequency, and even recurrent urinary tract infections, to name a few.
The term GSM emerged in 2014, and it used to be called vaginal atrophy.
Yeah, that's what I knew it as forever, and I still never heard about it, the term GSM, until this year. So the term has literally been around for over 10 years, but it's just now really gaining traction.
And that's just, thanks to so many people, like my favorite book, The New Menopause by Dr. Mary Claire Haver.
Yeah, that was a great one on audio as well. And the other audio one that I loved was Estrogen Matters.
Oh, excellent book.
With Dr. Avram Blooming and Carol Tavris.
And then our favorite urologist, Dr. Rachel Rubin. She's got some great podcasts, Instagram.
Yeah. It's fantastic. And also, I enjoyed I'm Your Peri Godmother.
Great name.
With Shelley Horton. It was really good. It was fun. And all of these ones that I've listened to audio are fantastic. And they all, read by the authors.
And you just got a new one, yeah?
Yeah. The most recent purchase was The Menopause Moment with Kelly Casperson, who's a urologist and also fantastic. Such all these people are.
I know. So shout out to these women.
Yeah, movement to really get GSM out there and help get the black box warning off the vaginal estrogen.
So stay tuned for a great episode as we guide you through GSM.
And why you gotta stay moist.
Your softness or your wrinkles, they are beautiful to me. Beautiful to me. I am beautiful.
So Sandi and I have been doing a ton of research on this subject because we're both menopausal and we didn't even know all this information.
Yep, we certainly are, and we certainly didn't. So we're here to pass it on to you, everything that we learned, because we want you to be armed with the information that you'll need to have a prepared discussion with your provider about this subject so that you can get the proper care, whether it's treatment or prevention for GSM.
Well, so let's start with what is GSM, Sandi?
Yes, this Genitourinary Syndrome of Menopause is thinning, drying, and inflammation of the vaginal and bladder tissues caused by a decrease in estrogen that comes with menopause. Beth and I like to call it gotta stay moist because it leads to the following symptoms. And I want you to consider whether you or someone you know are experiencing any of these. Vaginal dryness, irritation, pain during intercourse, urinary symptoms such as urgency, frequency, or recurrent UTIs.
Yeah, these symptoms can really impact your quality of life. And despite how common it is, many women do not seek treatment, maybe due to embarrassment or lack of awareness.
Yeah, and many of you have thought that these symptoms were just part of the aging process and something you have to live with. Well, guess what? You don't.
So let's break down the specific anatomy involved here. The genitourinary system includes your genital and urinary organs.
So just real brief, from the clitoris and all the tissues within the labia minora or the inner lips to the base of the vaginal opening. So all that tissue in there, also the entire vaginal canal, and from the bladder, the tube that runs from the bladder to the outside pee hole, all of those tissues are included.
We're going to start with the vaginal changes during menopause and the microbiome.
You know we love a healthy microbiome. If you've listened to any of our other episodes, you're already an expert.
Well, for those who haven't, and you should, the vaginal microbiome is made up of various microorganisms that naturally reside in our vagina, and they play a crucial role in maintaining our vaginal health and defending against infections.
Yeah, and the primary bacteria, if some of you remember in our classes, no. So the primary bacteria in all our vaginas is lactobacillus, and the food source for the lactobacillus is glycogen, and this is only abundant in an estrogen-rich vaginal lining. So lactobacillus can then produce lactic acid after it eats, and it keeps the vaginal pH at a healthy acidic level around 4.5.
Well, guess what? During menopause, our estrogen levels drop.
Wah, wah, wah.
Right?
Yeah.
And that reduces the thickness of the vaginal lining, which then lowers those glycogen stores. And so that shift means less glycogen is available, so fewer lactobacilli survive.
And it's like, dude, where's my food?
Well, menopause took it.
Yeah.
Reduced lactic acid production leads to a higher, less acidic pH.
Yeah, so this completely destabilizes the vagina, leading to increased dryness and irritation, like we mentioned before, and susceptibility to infection, and makes things really uncomfortable, to say the least.
Okay, let's get into more detail about the physical changes with GSM and your quality of life, because up to 80% of us menopausal women can have one or more of the following symptoms.
And I feel like the other 20% weren't asked.
Right.
Let's start with vagina symptoms because, it's in the title.
It is.
Your vaginal lining becomes thinner and produces less natural moisture, which means dryness and lack of lubrication. The thinning tissues can expose delicate nerve endings, leading to burning, itching, or irritation.
Ooh, you know what that makes me think of?
What?
And you have the receding gum line and your teeth get so sensitive.
Ooh, yeah, that hurts. But yeah, I can just picture it now. It's just awful. So your lining also becomes fragile, which means tearing or bleeding easily, sometimes after sex or even just doing routine activities like biking. And your vaginal walls also lose elasticity, sometimes leading to narrowing or shortening of the vaginal canal. It could get really small and tight and not in a good way, and especially during a speculum exam.
Well, if that's not enough, then we also have urinary symptoms. Yeah, so irritated tissue in and around your urethra can make peeing uncomfortable, mimicking a UTI, like that burning or stinging. Yeah.
Yeah.
And then decreased estrogen weakens your bladder and urethral support, causing sudden urges or the need to urinate more often. The protective acidic environment of the vagina is lost, like we discussed earlier. Yeah.
Yeah.
The microbiome, making it easier for bacteria to thrive, which can lead to recurrent UTIs.
Yeah.
You may also notice leakage with coughing, sneezing, or rushing to the bathroom.
Yeah, my legs are crossed right now.
I think we have that one.
Yeah, in case you make me laugh. And then the sexual symptoms. So you may have pain with sex due to the dry, thin tissues. And this makes it really hurt when stretched and may even tear during penetration. Ouch. So the pain or even the fear of pain can reduce your interest in sex. So no duh, right? Why would you want to do it if it hurts? And your partner wouldn't want to do it if he's hurting you or she. So reduced vaginal secretion also makes sex way less comfortable, right? So the tissues are thinner, and you also get, especially in the clitoris, decreased blood flow, and this may reduce sensation and definitely pleasure.
Mm-hmm.
So ongoing discomfort during intimacy, like keeps going and going and going, right, can affect your confidence, your relationships, and definitely your sexual satisfaction.
Well, so the bad news is GSM affects your daily comfort, your bladder health, and your sexual well-being. And left untreated, symptoms often worsen over time because tissue thinning and microbiome changes are progressive.
Yes, they are, but I'm now going to swoop in with the good news.
Yeah, good news. Give us some good news, Sandi.
These symptoms all can be treated and may even be reversed with the correct therapy.
So the gold standard treatment is localized topical vaginal estrogen in super low doses, which means minimal systemic absorption. And there's tons of studies out there showing how safe and effective this treatment is. If you want more information on these studies, please, we recommend reading the book Estrogen Matters by Drs. Blooming and Tavris.
Great book.
Yes.
Now, here's something interesting. All the areas concerning GSM, so remember we're talking about the vulva, the vestibule, the vagina, and all the urinary tissues, that all contain special docking stations called hormone receptors. And these hormone receptors are for estrogen and testosterone. So first, what does the estrogen do? It keeps your tissues thick, stretchy, and well lubricated. It supports healthy blood flow and a normal pH. What does testosterone do? It supports nerve sensitivity and blood flow, which plays a role in sexual desire and comfort, and it also helps maintain tissue strength.
So vaginal estrogen is prescription only, but it comes in many different forms like creams, tablets, and even a ring. And they all deliver a low dose of estrogen directly to the vagina and the surrounding tissues.
Yeah, and estrogen may also reduce overactive bladder symptoms as well as urinary tract infections, which is one of the most serious risks associated with untreated GSM, as urinary tract infections can lead to serious health complications like sepsis and even death, especially in us older adults.
You're not that.
Yeah. Getting there. We are not kidding, though, when we say that low-dose vaginal estrogen can potentially save your life and mine.
Yeah. Now, while vaginal estrogen is a powerful tool, it's not the only option and can be used in combination with other products. So here's some additional approaches you can take should you choose not to use vaginal estrogen or to use with your vaginal estrogen therapy if all your symptoms haven't improved.
Exactly. And here's one of them that you could use even with estrogen or by itself. And I'm going to say this once.
Here we go.
Okay. Dehydroepiandrosterone.
Nailed it.
Woohoo! So, which I'm going to call, and which most people know it as DHEA, and that's all I'm going to call it for the rest of the show. So DHEA is a hormone precursor that our bodies naturally make in the adrenal glands, and it gets converted to estrogen and testosterone in the body. So the DHEA is an FDA-approved prescription called prosterone, and the brand name is called Intrarosa. So remember those. And it's a non-estrogen product that once applied helps your body make estrogen naturally. So DHEA vaginal suppositories are these small, soft capsules inserted once a day, and they really may help to alleviate the GSM symptoms, particularly dryness and pain during intercourse.
And then there are tons of vaginal lubricants and moisturizers out there.
Yeah. So tons. So I'm going to say, listeners, beware. Once you search for the first lubricant or moisturizer or anything for the vagina, prepare to be inundated with vagina product ads in every one of your feeds on social media.
Sounds like you know about that person.
I do, doing my research.
So just remember, listeners, these over-the-counter products can help you quickly and temporarily address vaginal dryness, but they're not going to address the root cause. Yeah, so if you're only dealing with minor symptoms, you can certainly start here, but realize that it's only a quick fix.
Yeah, for sure. So lubricants, it really only used during sex, but they can help painful friction during intercourse and provide short-term relief from dryness, but they do not moisturize. And apply way before you start the actual intercourse part, because the earlier the better that you apply, and then you may even have to reapply at some point before penetration. The vaginal moisturizers, on the other hand, help to rehydrate but not repair the dry vaginal tissues, even when used on a regular basis. So it's important to note the differences between all the products and read the labels carefully.
All right, well, speaking of reading labels, Sandi, there is a warning label on vaginal estrogen prescriptions that we need to talk about.
Yeah, we do.
Yeah. So back in 2002, there was this huge government study called the Women's Health Initiative, or WHI, and it made headlines because it said that hormone therapy for menopause, meaning estrogen and progesterone, increased the risk of breast cancer, heart attack, and stroke.
Yeah, and here's what happened. Some of the WHI team went to the press against the wishes of other team members before the results were even published. So this is a big no-no. And so once it came out in media reports, doctors and women everywhere panicked, and millions just stopped using the hormones overnight.
Yeah, so sad.
Yeah.
Yeah, but here's the thing. That study has since been widely re-examined and found to be very misleading.
Yes, absolutely. So one of the reasons it was misleading was that the women in the trial of the WHI started the hormones in their 60s, long past menopause. So not the typical patients who begin therapy.
Yeah, so when scientists started to look closer, they found that younger women starting treatment around menopause didn't have the same risks.
Right.
And in many cases actually had health benefits.
Yeah, absolutely. So one of the worst parts is that this WHI study led the FDA to put a blanket black box warning on all estrogen products, even low-dose vaginal estrogen prescriptions. Ugh. So, but like we said earlier, vaginal estrogen works locally and not even systemically. And decades of follow-up show no increased risk of cancer, stroke, or heart disease.
Yeah, so experts from major medical societies have been saying that science does not support that scary black box warning. That probably prevented a lot of women from benefiting from vaginal estrogen.
Yes, so sad. And in fact, some good news is as of July 2025, an expert advisory panel,
including many of the names we've already mentioned.
Yeah, like all of them. I mean, they did such a good job, too.
Right.
It was on YouTube and Zoom and stuff. So, but they met with the FDA to recommend removing the black box warning on low-dose vaginal estrogen products, among other things. But this was the main one that we're going to talk about. So the next step is waiting on the FDA, to make their final decision to remove the warning. So we're all going to have to stay tuned, but don't stop listening now because we're about to get personal.
Part 1, the patient perspective. And duh, we're patients too. All right, Sandi, tell me about your dry vagina.
Oh. I want to do a nod to Betty White and say, my dry muffin. Not anymore.
All right, for those listeners who don't know what she's referencing, SNL.
Saturday Night
Google
Live.
Google it.
Betty White's dry muffins.
But seriously, that's what she's talking about.
Yes.
GSM, baby.
Come on now. Yeah, and so maybe a lot of you can relate to this, and that's why you're listening. But once you start talking about your dry vagina or start looking things up online, and then all of a sudden you've got a million ads coming at you on all these different products.
Yeah, luckily Sandi did most of the researching on that one.
Yes, out of necessity. Yeah, because it was weird. I enjoyed, trying to figure out what was going on out there and what all of our listeners might be faced with when they start researching, because it's very confusing and all these products are coming at you. And they do a lot of like fear mongering.
Right.
And it's like, this has no hormone in it. So,
because that stupid WHI study that scared women.
Yeah. And they're still using it to sell products.
Yeah.
And saying, no estrogen and then
although some women can't use estrogen. So
yeah.
There are women who can't. Just put that out there.
Yeah. So there's a very, I would say, small minority of women that absolutely can't use estrogen. But then there's other products that are better studied also for those ladies as well, and not just like this kind of what I call a crapshoot of all these online products that they're trying to sell.
What was your favorite online product they tried to sell?
Well, I can tell you from looking into all the ingredients and things like that. I mean, I'm not kidding you. 10, 11, 12 or more different ingredients inside each product. It was
right.
Like, why?
And touted as more natural, better. It's like, no, there's one ingredient in estrogen, but yeah.
Yeah, exactly. Yeah. It's just, because people just have it in their minds that estrogen is still scary. So we can't blame them. But if you see a product that reels you in, I would say go online and Google each separate ingredient and say, how good is this is this good for my vagina?
Should I be putting it in my vagina?
Yeah, I mean, there was peppermint oil.
Oh, God, feel the burn. Feel the burn.
Like frankincense.
Like, that's not naturally occurring in my vagina.
No, and so so a lot of these, if you look at them individually, these different ingredients, it'll say, Google told me, will increase the pH, which we don't want. We want to be acidic. We want to have a 4.5 pH. But so if you're going to put something in your vagina that's going to increase your pH, you're throwing off your whole microbiome.
Such a good point. Also, people can be freaking allergic to things,
Well, so many different, if there's that many ingredients, your risks are much higher to have an allergic reaction also.
Right? Irritant or just,
And it's like already irritated. So why do I want to put all these different things in there, right? Like for some of us, yeah. But they'll also use things to try to reel you in, like, take this quiz and all these different answers. But guess what? All roads lead to this product.
Yeah,
I'm like, this will make you all better no matter what you say. And then even saw one that was like, had a Dr. Oz on there. And he always said during his show, too, he goes, if you see me on any kind of advertisement, that's not
sold
me.
Out. Sold out. Oh, it was like AI generated. Yeah.
Or they just put it in there, and he just like, I do not do that. And so, if they're using him, then it's probably a non-starter.
Interesting.
Yeah.
Hey, let's talk about because bioidentical, right? I remember hearing that one all the time.
I love this because way back when I was practicing, and one of my mentors told me this straight off, because I had patients asking about, well, I want bioidentical. And she said, well, guess what? Everything that we're giving them in prescription is bioidentical.
I mean, when you think about it, it makes sense.
Yeah.
Duh.
So it's just, we were researching, and although it sounds scientific, it's really a made-up marketing term.
Yeah, it's just marketing. That's what it is.
Yeah, isn't that interesting? So it just means the hormone has the same structure as the one your body makes. So many FDA-approved hormones already are bioidentical, like I just said, but the difference is that the compounded bioidentical products are not FDA regulated or tested for consistency.
So because you hear that term a lot, you do. And so it's just the pharmacies are compounding it. rather than you're getting it from the FDA drug.
So they're not
Approved drug.
safer.
Yeah.
They're not more natural, and they're just less controlled.
Okay.
Yeah.
Not to say that there aren't fabulous pharmacists out there making wonderful compounded products.
Yeah, and
not saying that at all, but just saying you don't have to get the quote unquote bioidentical. That's just a marketing tool.
Yeah. So don't
Doesn't make it better or
Don't let that be the thing that pulls you in a certain direction when you could just be having vaginal estrogen that's already made for your vagina.
From and approved by the FDA.
Yeah, exactly.
Tested and
yeah. Exactly.
It's good stuff. That's what we're trying to tell you.
But don't fall for the banana in the tailpipe. That's anyway, that's from the Eddie Murphy movie.
No.
Yes.
I don't remember that one.
God, what was it? Oh, Beverly Hills Cop.
Really? God, that goes way back. That goes way back.
Oh my gosh, so any of you baby boomers out there, no, don't fall for the banana in the tailpipe.
Don't fall for the bioidentical in the vagina.
Yeah. Exactly. Google it, people. It's hilarious. So for me, as we were supposed to be getting personal, so I was on like Divigel and oral progesterone for 2 years because that was what was going on at the time. That like, oh, you should only be on hormones for 2 years, and then
WHI study again.
Yeah, and then just get off. So I didn't start Vagifem. So that is one of the pill forms of the vaginal estrogen that you just pop in, and that helps to make your vagina more healthy and moist. Gotta stay moist. So Vagifem is a great product. But it wasn't till like after I was told to get off hormones, and then they didn't say, hey, you're gonna need this. No one said this. Hey, we're taking you off, so get on this, which would have been awesome. I had to wait until I was having pain with intercourse and just, that feels, let me try some lube or whatever. It's like, and then that only lasts for a short time because I'm living proof. It just keeps getting worse.
Yeah.
Yeah.
So you weren't treating the problem. You were just treating the symptoms. Yeah.
I had GSM, and I was not treating it at all. I was just given the Band-Aid of the lubrication. So then once I got on the Vagifem, hey, wow, this is great. I love this stuff. Yeah, I love the estrogen. So it worked for years. So now it's like, oh my goodness, you know what? The vestibule is not getting taken care of.
Oh, interesting.
So, I mean, all this research, it was like, yeah, wait a minute.
Well, what's one thing we found out was that if you're inserting the pill or the estrogen too high into the vagina, maybe enough of it isn't getting to that outer part,
Yeah. Who knew that? Not one person, not one direction that I've ever read or anyone said, just put it like in the first third.
Mm-hmm.
Yeah. And so I have not, until I hit a wall.
Well, that's because we were taught how to put tampons in that way.
Yes, you go all the way in, and then you push it, push.
Don't do that down with your estrogen products.
Yeah.
Unless you've got the ring. That's all the way up there.
Yeah, that's different. Yeah. But you don't want that falling out. That's the.
Sorry, we shouldn't laugh.
It happens.
I'm sure. A good sneeze and that thing's like, gone. That thing is gone.
Yeah, but now I'm looking for something else for the vestibule too. So, I mean, I'm thinking about DHEA for sure.
That sounds so good. I am too. I am on currently systemic hormones, and I haven't yet to start vaginal estrogen therapy. But after researching all of this, I cannot wait because it's more about prevention really at this point.
Yes.
So I want to get on it now.
Right.
Before these things start to occur.
Yeah.
Why wait? Yeah.
Right. And you have to really have a good relationship with your provider in that, tell me how it looks down there. So, I mean, I'm just very comfortable looking at myself in the mirror with the little phone light or whatever. And then I know what I'm seeing because I mean,
You were a
I looked
provider
at
for so long.
right tens of thousands of vaginas, but I wish I could go back now, and just do what I think would have been a better job.
You did a great job.
Well, I mean,
don't downplay. This is something that's just come out, all of this. This is not...
Yeah, just learning this.
And they don't teach this stuff in school.
No,
they don't.
Right. That's why a lot of the experts are even saying they don't even have courses in med school, let alone for a nurse practitioner. Yeah. And I was adult health, not even women's health. So I was lucky to be brought into the fold of women's health during my last 10 years of practicing. But I loved it, but I wish that I had known more about it. And I do have to move forward, let that go. But it just like, boy, I feel like I could have done
so much
more for my patients. Just and there were plenty of times where I would order estrogen, vaginal estrogen, and then I get a phone call. Like once they picked it up, and that stupid black box warning would be on there.
Trying to kill me, lady?
It's like, wow,
it says I can die of cancer.
I'm like, oh no, and I'm just like, I think, what am I going to say? I mean, I said what I could. It's like I really don't. This is not.
Well, it's scary.
Absorbed systemically, and it just works locally, so it should be safe. But then, when I see you next year for your exam, the exam's not going to be any more comfortable. And if you did want to have intercourse, because some of them don't care.
No,
it's like,
but it goes beyond that. That's the thing. It's not just about sex.
Right.
And this is what I've learned a lot lately, too. Just sitting for some women is just uncomfortable. Sitting in jeans or tight clothing.
Yes. And that's one of the cues that I got for myself was actually the center seam of my Lululemons when I would work out and walk on the treadmill or whatever. It's like, this is not as comfortable as it. Like all of a sudden I'm noticing it. I'm like, well, that's new.
I just never knew that could be so uncomfortable for women. We're sitting here just thinking they have to be uncomfortable. That makes me sad.
Yeah, it does. And to, to have people thinking that, it's just part of my aging process. There's nothing to be done. I go in for my well woman exam. I might get a pap smear. But if I don't say anything, you get everything looks good. So that was the part where if you can communicate with your provider and say, hey, can you, is there any redness at all? Or what's it really look like? And can you touch some different parts in there? My vestibule, my... my labia, and can you see if the hood is still moving on my clitoris at all? Like different things. Can you please really look in there and see if I would benefit from some vaginal estrogen or what?
And
just
if you get
push them a little bit,
ignored or not listened to, then find a provider who is menopause certified. Yeah,
and they're actually hard to find.
Yeah, it's unfortunate. It's true though.
Yeah,
it's true though.
Definitely. And then also, I just heard that only about 10% of urologists in the U.S. are female.
Wow. Yeah. Okay, here's the thing, right? Because if this happened to men, if their penises started to rot off at age 50, not that your vagina is rotting off, ladies, but I mean, seriously, this stuff would have been, this is like, this would be freaking, every man would be on this.
Yeah, absolutely.
Yeah. Don't get me all riled up there, Sandi.
I know. So, yeah, but there are some great men out there that are doing women's health as well. We don't mean to be that way, but
well, I think part of it is that women are finally at these, able to take these roles in healthcare and in research, and this stuff is finally being studied.
Yeah, and be on the expert panels and committees and work in the FDA making the decisions.
Once again, shout out to all these wonderful women who are doing this for us.
Yes.
What else, Sandi?
Well, tell us about your dry muffin. Oh, no, sorry, you said you didn't have one.
Can I tell you my funny story, though?
But yes, please.
Because, it's Sandi and I's funny story. But So GSM, hard to say, Genitourinary Syndrome of Menopause. That's a long one.
Yeah.
So we're like, hey, let's do an acronym
Yeah.
for GSM, something people will remember. And so we're trying to come up with stuff. And I'm like, oh, let's ask Chat GPT. Right?
Go to.
So I'm like, okay, Chatty, what do you got for me? Give me an acronym for GSM. And so it starts pulling out these crazy terms. Can I look it up real quick? Because I totally forgot.
Oh, yeah.
There were some good ones. I mean, the one I remember is the best one.
But our one that we could safely say, and our favorite one was what we already told you, was gotta stay moist. Well, that sticks in your head, and then you're like, that's the whole thing. I've got to stay moist.
All right, well, came up with some pretty crazy ones. So there was grating sandpaper muff.
Oh, no. Yeah, no, mine felt like sunburn. Yeah, one time. Sandpaper.
And then my favorite one, are you guys ready? Is everyone ready for this?
Oh, God.
Yeah. Grandma's shriveling meat flaps. Oh, Chat. Tell me that.
Okay, true story. After you read that to me before, I was like, oh my gosh. And here we read that your inner labia can actually disappear and reabsorb.
What? Where does it go?
I know. Where does it
reabsorb?
I know. Yeah. So it starts disappearing. So when I did
shriveling meat flaps,
I know exactly. So when I did my little self-check, I was like, holy crap! Like half of my left labia minora is missed.
You are really sharing two times, Sandy.
Where'd it go? Is it going to regrow once I get? I mean, maybe because it says it might get better. So
that's actually a good experiment. Let's do it. We're going to do it.
Stay tuned.
Right?
You'll have to listen to other podcasts of ours in the future to find out the answer and see what
Sandy's meat flap came back.
What happened to your labia minora on that one side? And when I was examining patients too, I remember telling one patient in particular, I'm like, you don't have a labia on an inner labia on one side. She goes, no one's ever told me that.
She may have, right?
She may have just been born that way. But I'm cringing at myself going, oh my gosh, did she have GSM already? And she needed some vaginal estrogen up or on the vestibule and up in the inner labia. And I just, it wasn't on the forefront of our thinking at that time.
It's just funny that triggered all that for you.
I know. This podcast is very triggering for me for a lot of things. All this stuff coming back to me, after all this time. But thank God we're all learning together.
Yes. So thanks for joining us on our journey. Part 2 for your partners.
This may be brand new information for a lot of you, and you might be worried about possible exposure of estrogen to your partner, or your partner might be worried about getting exposed.
Yeah, I think that's a legitimate concern, yeah?
Yeah, definitely if you don't know, and, we don't know what we don't know. So just remember that estrogen in these treatments is a very low dose and designed to act locally, just on the vaginal tissues.
Yeah, actually, clinical studies have found that even with frequent intercourse, the amount that could transfer to a male partner is negligible, meaning no significant risk.
Yes. So, but that being said, let's help you start the conversation with the important information you and your partners need to know when using vaginal estrogen.
Okay, so apply your vaginal estrogen cream after sex, not before.
Estrogen is not a lube.
No. If you are using a vaginal estrogen cream or tablet, wait several hours after insertion, ideally overnight, because this allows for complete absorption.
Yeah, so that's for cream and tablets. For the estrogen ring, called the S-string or E-string, it's inserted further up in the vagina, way up in there, and it delivers estrogen slowly, like over 90 days in very small amounts, which will not affect your partner. And it's highly unlikely they'll even feel it when you're having intercourse, so don't take it out and do the in and out thing with the ring. Just
in and out thing.
I know. And sometimes people lose them or they fall out. And it's like, 5-second rule. Let's put it back.
Stop it. Clean it first. God.
Take
do you know what? Just don't take it out.
Yes, there you go. That's what I'm trying to say, basically.
But you know what? If you or your partner are still concerned about exposure, you know what? Use a condom, because that's going to provide a barrier.
Yes. So if you are in the condom wearing phase of your relationship, and then you do slip up and put the vaginal estrogen cream in, and then they're like, oh, let's have intercourse. Okay. It would affect the integrity of a latex condom, putting you at higher risk for an STI or sexually transmitted infection. So this is not the case, however, with the S-string or the vaginal tablet, just the cream.
So what's the main takeaway, Sandy?
So for this section, the most important part is just having that intimate conversation with your partner so everyone is just on the same page and all concerns are addressed.
Part 3, the provider experience. So for our listeners who don't know, Sandy was a women's health provider for many years.
Yes, ma'am.
Yes, ma'am. So she's seen it all. She's seen it. How many vaginas have you seen? Reminder.
Oh, yeah, reminder, tens of thousands. I tried to count them up once.
That's a lot.
Yep.
So you've actually seen visually what GSM looks like.
Absolutely. Yeah, I've seen, I took care of patients from age of 13 up all the way. And so, yeah, I've seen, the younger vaginas that are, normally it's kind of like a nice light pink color inside the vagina and moist. And then there's usually rugae in there, which are just ridges that are naturally occurring in the vagina. And a normal kind of like white thin discharge. It's all normal.
And then what does a GSM vagina look like? And,
well, GSM actually looks very different. So starting with the speculum being a lot less comfortable going in. So, yeah, making sure that there's a lot of lubrication. And I always would heat up my speculums anyway. So
nice. So
trying to, it'll give them a little bit more comfort and the ability to relax a little bit. But so the inside, if you've got full on GSM, and it's a lot of times it'll be like really red and there won't be any rugae left. So it's super smooth, not very stretchy. It looks painful because it's red, and you could tell it just doesn't have very much elasticity, and it's normally dry. So, in that case, I just make sure I have that enough KY on there. That's what we used in the clinic, and just to try to make it not painful, because it just makes you feel bad as a provider. Just go, I'm glad you came in, and I can see that you must be bothered by this. But sometimes they don't say that they're bothered by it until you go in and you're like, is this uncomfortable?
Wow. They just expect that to be part of normal aging.
That's normal aging. Maybe they had stopped intercourse in the last year or two.
No, maybe nothing's been up there for a year.
Right. Maybe they said, well, I'm done.
I didn't know it was that atrophied.
Yeah, I'm not doing this. Or sometimes they'll say, boy, intercourse is really uncomfortable, but, I just do it. We're trying lubrication, but it still hurts.
Wow. Yeah. So have you seen then the before and after? Like, have you prescribed the estrogen and then seen the after effects?
Yes. It's like a miracle.
Really?
It's so different. Yeah. So if they do use it as prescribed, and like before I see them again the next time, and I took really good notes.
Yes.
So I got in trouble for seeing my patient, like spending too much time with my patients. But I'm like, but I want to tell them everything. I want them to learn, and I want them to do what I prescribe. So, because I know it works. So I explained to them what to do. And then if they did it, they come back, because I'll look at their chart and I'll go, oh, okay, I want to see how this looks. And like, if they stayed on it, I'm like, it's night and day. It's no longer red. It's now a lighter pink. It's no longer dry. It's got moisture, a little bit of white, normal discharge. And sometimes when it's red, it can have like a yellowish discharge. And that's just kind of sloughing off from the inflammation, and it looks completely different. And the exam is much more comfortable for them, and they may have even gone back to intercourse.
Wow. That's amazing.
Yeah.
So right on. Use that estrogen, ladies.
Yeah, it works. It works.
What any helpful hints you would tell your patients when you prescribe the estrogen? Like, is it going to work right away? Is it going to?
Great question, because even when I started, too, I was given directions, and so it's really the cream, the estradiol cream, or the Vagina tablet that goes in that have the same directions, which is nightly for 2 weeks, and then twice a week thereafter. And that's forever, twice a week thereafter. And that wasn't too hard to follow, that twice a week once you get to there. But, things happen in life, and sometimes, even for me, if I'd forget. And I'd gone like several weeks without because of something that happened, in our lives. And so then I would have to restart. And I would restart and do it 2 weeks straight again.
Okay.
And then twice a week thereafter. So if you fall off the wagon, you can get back on.
That's good to know, right?
Yeah. But the symptoms will come back. And that's how you know, oh, crap, I forgot. It's been all this time. It's like, no wonder it's, not feeling good down there. So, no shame. You just get right back on the horse.
Okay, so use it consistently. Give it time to work. Is it going to work right away, or?
Well, for me, I think I went on it just when I was starting to have the need for lube with sex. And I went on it, and it really started working for me. Within 3 weeks, I felt a difference. But let's say it's someone who's not been on anything and been suffering longer, and it's drier and redder and tighter. It could take up to 8 weeks.
Okay. So don't give up.
Yeah. Don't give up. There's no reason to give up.
Yeah.
Because you're giving your body, your mucosa, what it needs to get back to normal.
Okay. All right. So give it time and then stay on it. Stay on vaginal estrogen, the rest of our lives, really?
Yes. I mean, I hope, if I'm bedridden, someoone's still putting in my vaginal estrogen,
right?
Because I don't want to get a UTI and die of
I'll do it
sepsis.
for you. Yeah, do it for me. I'll do it for you.
Right. Oh, thank you, friend.
So you said something earlier. You compared it to other things that happen as we age naturally.
Yeah, exactly. Well, here, some people just say or think, well, it's just part of aging, so why should I do anything about it? And it's just, an inconvenience or messy or whatever. But, other things are part of the natural aging process, like decreased vision or decreased hearing. And you don't see people say, well, it's just a natural part. I don't want to have to get glasses or hearing aids. But it's like most people do get glasses or hearing aids. So why is having some vaginal estrogen somehow not appropriate?
Yeah. See, I love that. You're going to get some hearing aids, get some vaginal estrogen, darn it.
Yeah, come on. Let's do it before we lose our hearing and vision.
It's preventative.
Absolutely. So that's the key to this whole menopause momentum thing, and menopause having a moment, which is the name of Kelly Casperson, Dr. Kelly Casperson's book, The Menopause Moment, which is fantastic.
Yeah, highly recommend.
Yes.
So what if it's not time for your pap smear and you're like, well, I don't want to go in. You got to wait till it's not another year or so.
Yeah. When all that changed, so I was working as a provider when they changed the recommendations for pap smear. So instead of annually, then it was, every 3 years or every 5 years, depending. And we knew we were going to lose our annual exams. People weren't going to come back because they just focused on pap smear.
Mm-hmm. And it's so much more than that.
Oh, yes. I mean, ACOG was pushing towards, no, please still come for your annual exams, because we find so much other things and we get to talk about other things when you come in annually. And even I fell off the wagon a little bit on going in annually. And then all of a sudden I had a little postmenopausal bleeding. And I was like, oh, what's this? I should have been coming in every year. And it turned out to be fine. But so we just find stuff and we talk about stuff and we can catch early things that we'll ask you only on these annual visits. Like I even had like a mentor tell me once, why do you, I see you always ask people if they're having pain during intercourse. You don't have to ask everybody that. It's like, but when else are they going to be asked that? I've had women, so many women say, and they're like in their 50s or 60s, like, no one's ever asked me that. I'm like,
So
you're
kidding
me. But you've got to feel comfortable with your provider. If you go in every year, you can catch stuff early. And that's the hope. So I would urge all of our listeners, like, just go in once a year anyway. Most insurances cover an annual visit. It's not just for pap smears.
Okay, quick summary, listeners. Genitourinary Syndrome of Menopause isn't just a minor inconvenience. It's a serious health issue that deserves attention.
Absolutely. And here's your call to action. Seek out a knowledgeable healthcare provider for your next exam if you don't have one already.
We recommend a certified menopause provider, but if you can't find one in your area, ask around.
Yeah. Ask your friends, ask at your next book club meeting, and why not recommend one of the books we mentioned today for your next read?
Because it's important to keep learning and stay informed about GSM.
Yeah, listen to additional podcasts and read all these new books related to menopause. This will empower you to have confident discussions with your provider and remain up to date on the latest about managing GSM.
Because now that you know why, you'll never forget, you gotta stay moist.
I'm Sandi.
And I'm Beth. And if you have a vagina or know someone who does, then please like, share, and comment with your thoughts or topic suggestions.
You can find us on all podcast platforms like Spotify, Apple Podcasts, and YouTube.
Bye, everyone. Thanks for listening. This episode of IYKSWAV is so important, it could save your life.
Yeah, that's true. And you're probably asking, why is that, Beth? And that's because I couldn't land it. I was like
The gold standard treatment is localized topical vaginal estrogen in super low doses, which means minimal systemic absorption. And there are tons of studies out there showing how tons